Hello and a very warm welcome to our channel. My name is Maria and I am the owner and founder of the New Mummy Company here in Oakville, Ontario. And today I'm going to be talking to the lovely Dr. Vora about the connection between bodywork and lip tie and tongue tie. Dr. Vora, a very warm welcome.
Thank you. Thanks.
I'm so glad that you're here to talk to us. And your talk today actually coincides really well with a recent video of ours that we did with Caitlin, one of our lactation consultants. So I feel like this is a great additional talk to have so that we can give parents just that little bit more information. Coincidentally, if you haven't seen that video and you are looking for more information on tongue ties and lip ties from a feeding perspective, then go check out that video. Interestingly enough, Caitlin did mention bodywork in the video, so I do think that there's some great synergy between our conversation today and the one we did previously with Caitlin. So without further ado, let's get started. But first of all, Dr. Vora, would you mind giving everyone a brief introduction to who you are and what you do?
Sure. I'm Dr. Vora. I'm a chiropractor by designation. My passion in chiropractic is women's health, so prenatal, postnatal care, and pediatric care as well. And I work out of the wonderful town of Milton, Ontario.
Wonderful. Well, we're so pleased to have you here. So first of all, the tongue tie, lip tie phenomenon.
Yes.
Would you say, and this is always something that interests me, is this something that's happening more, or is this something that we are just now more aware of?
I would definitely say it's the latter.
Okay.
The one great thing about research, although it takes long, it does catch up. So I do think research now is catching up. And I do think the other aspect of it is they're realizing in different industries how related things can be. And so when it comes to tongue tie, I think one of the big things is people are recognizing it more because they're recognizing the other patterns that before research came, ahead, were separate items, but now they're seeing that they are very related. And so I don't think it's being, overdiagnosed. I think it is being recognized better. And I think there's more support for it now. And so that's why it's becoming a buzzword.
And as a chiropractor, how do you come to be involved with a baby? And obviously the dyad, the parent and the baby. How do you come, what part do you play in a tongue tie scenario or a lip tie scenario?
So most of the time, if I've seen the baby before they've been diagnosed with a tongue tie or a lip tie, most of the complaints are my baby tends to prefer one side and not the other. My baby tends to have a posture with their head either cocked one way or turned one way. And they don't seem to, know the other side of, their field of vision or their range of motion in terms of their neck. And so most of the time I'm seeing mums who have noticed a bit of preference with the baby. And then I will take a look at, and talk about feeding and how feeding is going. Bottle feeding or breastfeeding, it doesn't matter. If the baby has a preference, it could be because their neck is really tight. And that could also be affecting how their jaw sits and how they suck. So that's how I get involved before they're actually diagnosed. If they've already been diagnosed and if they've already seen a pediatric dentist, I will see them after for any other sort of body work. So as I mentioned, they are very related in terms of neck posture and jaw posture. And babies who frequently have tongue ties have a new pattern of suck. Once their tongue or their lip tie is snipped, essentially they have to relearn a new pattern with this, whole new freedom of movement with their tongue or their lip. And that's when I come in. And so trying to get baby to learn to, discover the side that they unfortunately were too painful or too uncomfortable to get to know, and getting mom to help assist that as well. And that, so I get involved either before they get diagnosed, and then I say, oh, it's time to see a pediatric dentist or a pediatrician to assess that. And then if they've already seen someone, I'm addressing everything after.
Okay. So in terms of a medical professionals, who are a family likely to come in contact with if they suspect that there is a tongue tie or a lip tie, or if before they understand that it's a tongue tie or lip tie, if they're having feeding difficulties, who could they expect to see, and why would they expect to see those professionals?
So two common ones, at least in the beginnings of many of these stories, is the pediatrician, and outside of the pediatrician is a lactation consultant. So someone who actually watches mom feed and watches the baby feeding is really ideal. So I do definitely recommend most moms to see a lactation consultant, because many lactation consultants can recognize if there is a lip or a tongue tie issue, and if mom is experiencing issues with feeding. So either, pain with breastfeeding, or babies not, having an easy time finishing the bottle, taking quite a bit of time on the bottle, or taking quite a bit of time on the breast. And so a lactation consultant usually is, either numbered 1 or number 2.
Okay, perfect. So when a family comes to you and they've had that diagnosis, maybe they've had the frenotomy where the tongue tie has been snipped, what do you do with the family? And I guess what I'm trying to say here is, with all due respect, sometimes people are afraid to bring their babies to a chiropractor, and they think that chiropractors are all about cracking bones, and so therefore it's not safe to bring their baby. So obviously, I know different, but obviously we want to make sure that everybody understands the benefit of having your baby seen by a chiropractor, what you can do to help them. So would you explain a little bit about the gentle aspect of those treatments?
So quite a bit of my work with babies involves more muscular work, more joint work. Adjusting wise, I don't necessarily adjust babies. If anything, I would say I probably mobilize their joints. So mobilizations are gentle movements of a joint in its normal physiological range. So for example, this thumb can only go so far this way and go so far that way. And so with babies, I work within the range that their joint will allow me to go. I don't force anything. So one big aspect to chiropractic is that it's flexible, right? So even with adults, if someone's uncomfortable with adjusting, we don't have to adjust. We have lots of tools in our toolbox that we can use. When it comes to babies, I use mobilization, so just gentle movement of the neck in the range that the neck will allow me to go. So I do not force anything. And then outside of that is muscle work. So with any joint, we have ligaments and muscles that cross those joints. And so usually addressing the muscles and just addressing a little bit of joint movement usually does resolve things. So that it's incredibly gentle that way. And most of the time babies do sleep through it. So, I've not had the experience of, a baby not liking what we do. And so definitely I say, find someone who you trust, find someone who has, word of mouth is a great way to get to know a chiropractor, and even any other body worker. So a physiotherapist or an occupational therapist is also an option.
Wonderful. So what does the word body work actually mean then?
So body work quite a bit is related to movement. So one of the things with body work is recognizing where tension is. And with movement, if there's a reduction in movement in a certain direction, we know that direction needs a bit of what we would say body work. But what we mean is trying to encourage movement either passively, so we would move the baby, or actively, so encouraging the baby to move their own head or move their own neck, or when it comes to the jaw, sucking. So, encouraging them to track something so they can actually use their muscles. The other thing is, simply just offering a finger for sucking and then letting the baby follow the finger from side to side. So this, once again, encouraging the jaw movement with the neck movement. And so body work essentially has a passive aspect to it. So we're doing it for the baby, and an active aspect to it. So encouraging baby to do it themselves.
And what are the benefits or the improvements that a parent would expect to see following a session with somebody like yourself?
So one big improvement that a lot of parents talk about is improvement in stamina. So if baby doesn't like tummy time, they notice, when baby can actually move their head side to side and lift their head up equally, baby can hang out there for a little longer. So it's a bit more pleasant that way, right? Feeding can be more pleasant. So if mom is breastfeeding, now she can switch between left and right because baby now doesn't necessarily have a preference because they can move their head in the direction they found difficult. So improvement in terms of movement. Play is another one. So they use both hands to reach versus one side. And the other thing is actually tracking, right? So the baby now can recognize and track, mom and dad in terms of like in their field of view, because if they were sort of stuck in one way, they're not likely to look this direction. And if anyone comes from this direction, can be startling sometimes. And so baby can now recognize they have a lot more room to look around and a lot more anticipation for things coming in and out of the room, right? So they're not really startled whenever someone kind of comes surprisingly out of an area that they can't see. So I do notice that babies seem to be a little more calm and a little more less tense is the best way to put it, because now they can do a lot more physically that they couldn't do before.
Okay, wonderful. So you've talked a lot about movement and preference on one side or another. So then reading between the lines, is there then a connection between a tongue tie or lip tie and torticollis, which is that tightness in the neck? Explain why that's the case and how that obviously can negatively impact a baby.
So anatomically speaking, the neck and the jaw actually share quite a few muscles. And so how we chew and how we swallow, we use not only our jaw muscles, our facial muscles, but also our neck muscles. And many people notice this, especially if they suffer from jaw pain. Turning their head to one side can cause a little bit of jaw pain to come on. And it's the same with a lip tie and a tongue tie. When a lip tie and a tongue tie exists, essentially the baby starts to adapt to this decrease in movement either in their tongue, so they start to use their jaw to actually draw the food out versus the suck with their tongue. And so that starts to affect how their jaw muscles are in terms of, either they're tight or relaxed. And the other thing that could also happen is if they have a feeding preference, one side of their cheeks will compensate because the other side isn't opening up as much. And so there can be a muscle imbalance, and that changes how their jaw sits and how they swallow and suck.
And so then, and correct me if I'm wrong, the assumption then is that the body work that you will do will make sure that the baby is able to have the ability to turn, like you said, have that range of motion so that when somebody comes past them, it's not coming into a blind field of vision, that they can actually listen, hear, and see that person come from behind them. Okay, and so obviously then that ties in with flat head syndrome if the baby was to be locked in one position all the time. And that's another conversation for another day.
Yeah.
But so torticollis is something to look out for. In terms of body work for torticollis, which is that tightness in the neck.
Yes.
Would you be able to show us what that would look like?
Yeah, so I will bring my handy dandy doll here. So torticollis normally is recognized by how the baby sits in terms or lays. So if this baby was laying on its back, most babies who have a little bit of torticollis tend to sort of turn away from the side that they're having the tightness on. They could be a little bit of a cock in the head, so they tilt towards the side and they turn away from it. And so this baby, we can assume, is having right-sided torticollis. And so they tend to sort of, when they're laying back, always kind of look in this direction. And if you sort of encourage baby to look this way, they tend to just sort of look as far as they can go, but they never go past sort of a certain amount. And so they kind of sit with their chin, one side kind of cocked up and one side closer to their collarbone. and turned away from it. So that's one way to sort of recognize it. And this can be on a spectrum. So they could be a mild torticollis, and they could be, you know, a moderate to a severe torticollis, where the baby actually is sort of completely turned and unable to go that direction.
Okay, wonderful. Wow, that was quite a lot of information. In terms of the families that you see, are you seeing primarily newborns who are being diagnosed and just immediately post-diagnosis? Or can families see you later? Say, for example, if the baby hasn't been diagnosed until much later, maybe, you know, even if that sort of the flathead has been diagnosed, and then they can come to see you. Is there a cutoff point where you can and can't help?
So I do not think there's a cutoff point. I think at any time a parent recognizes there could be some sort of imbalance, either in movement or in things like, you know, baby just takes too long on the bottle, is alert, awake, but just has trouble emptying the bottle. Any time is a good time. I do say earlier the better, so that way, you know, you're setting up baby for growth a little bit better. And even if it's, you know, in terms of the toolbox I have, even if my toolbox isn't appropriate at that age, I can always refer a mom or dad to someone who definitely can help them at whatever age group that baby is at. So I think getting assessed is definitely a good idea. And then we can always see what I can offer or who else to pull into the team who can help the baby.
Okay, wonderful. So the takeaways from today's conversation then is that there is help and support out there if your baby has a tongue tie or a lip tie, and it doesn't stop at the point of having the tongue tie snipped, that the support should be encouraged beyond that. There is also help and support available for babies who have ongoing issues with neck, turning, mobility issues that may be diagnosed at a later stage. And inevitably, if it doesn't get diagnosed for quite some time, then there can be that flathead syndrome, which plagiocephaly is what your pediatrician will refer to it as. So in terms of your assistance with families, how long do you typically support them if you saw them for a tongue tie, lip tie?
Typically, I would say most of my appointment or treatment plans are pretty short, because a lot of what I do is educating mom and dad how to do it every day, right? So most babies rely on mom and dad to do the exercises. So that's great. So as long as mom and dad can definitely do it consistently, most of my treatment plans are usually 3 to 4 appointments. And by then, usually baby has either resolved. And that's the great thing about babies is they respond beautifully and they respond instantly. And so maximum, maybe I've seen a family 4 times. And
Okay.
most of the time, we don't even need that much, because mom and dad pretty much take everything I teach them and they go home. And most of the time, it's completely resolved. If I have had to see them longer than 4 appointments, I always pull someone in. So a lactation consultant, you know, the pediatrician by some chance or need for that. But most of the time we pull someone else into the team. And so that helps things along quicker.
Wonderful. Well, I've really enjoyed today's conversation. Thank you so much once again, Dr. Vora. It's been an absolute pleasure to chat to you. I have hoped that you found some little nuggets of inspiration and help and support to know that, most importantly, there are specialist providers of help out there. Dr. Vora being the chiropractor, we have the lactation consultants. No matter where you are, there are people who can help you and support you with any of the feeding issues that you encounter for your baby, or any of the additional issues that may occur. If you've liked today's video, we would love to get a thumbs up from you. And we would also like to hear, did you experience tongue tie, lip tie, torticollis, flathead, any of those happen to you, and what did you do? What did you find beneficial? Did you know that any of these services existed out there? We want to make sure that as many new parents as possible can get the help and the support that they need. That's what we do, and I know that's also what Dr. Vora's mission is too as well. If you would like to hear more videos and get the notifications from us, then hit that subscribe button so that you'll get the notification when we release a new video every Thursday morning at 11 a.m. Until next time, we look forward to chatting with you again soon, and Dr. Vora will be back with us for another video very soon. We're very excited to have her join us for a number of videos because she's got so much wealth of knowledge to share with us. So for now, Dr. Vora, thank you so much.
Thank you.
And until next time, take care. Bye-bye.
See ya.